Hello, my name is Dr. John Verhuel. I'm a family practitioner and I've been practicing for over 30 years in Central Virginia. I hold a master's in public health from VCU, and as such I've been medical director for the state police for over 15 years, and I have been the medical director and involved with the healthcare of local firefighter organizations for almost a decade. I am a firm believer in the value of tumor markers for the detection of cancer. I've ordered cancer tests from 2020 Gene Systems for many years. And at least 2 occasions, this has led to direct early diagnosis of lung cancer, among which I've also picked up pancreatic cancer and colon cancer in its infancy. These tests have no question in my mind saved the patients' lives. In 2019, I began using 2020's new OneTest for the early detection of multiple cancers as part of yearly physicals for several fire departments in our Richmond area. Scientific studies have now proven that firefighters have a higher than average risk of numerous cancers, including those of the digestive and respiratory tracts. I am unaware of any other product that can help identify so many of these cancers at an affordable price. OneTest has been very popular with the firefighters that I work with. Artificial intelligence can also improve detections of cancer. Much has been written about the potential of AI to help doctors diagnose and treat diseases. 2020's use of machine learning in OneTest makes a great deal of sense, since there are vast quantities of data from parts of the world where this testing is done every day. Screening for the OneTest is something that I do with my patient population once yearly. On that basis, I can go ahead and monitor what the tests were like beforehand and then follow them through. However, if I have an abnormal value, I will go ahead and ask the patient to come back more frequently so that we may go ahead and recheck these markers to make sure that they come back down and that there's nothing to worry about. The goal of the screening test like OneTest is to encourage follow-up testing for those with the greatest likelihood of having cancer and getting them to the help they need before cancer spreads and becomes uncurable.